Namaskar, greetings to future group of institutions and greetings to the future Institute of Pharmacy. Greetings to Dr. Rahul Shukla, who was actually a former lecturer and one of my lecturers in the Amity University, Lucknow campus. Thank you very much, sir, for the opportunity to give this online webinar to your students, and greetings to all of you that are listening, and thank you for your time. My name is Chukwunedu Chioma Faith, Mera Nam Faith here, and I am from Nigeria. I studied at the Amity University, Lucknow campus from 2014 to 2018, where I graduated with a 9.57 CGPA, which made me the best graduating student at my time, 2018. So when I was through with my bachelor's degree at Amity University, my goal was to go for my master's program. And so to do that, I checked most of the requirements that the schools needed. And I found out that most of them actually wanted me to get a license from my home country. And since my home country is Nigeria, I had to come back to get a license. And the way it is done in Nigeria is different from how it is done in India. So since I didn't school in Nigeria, I have to do a 1-year training, and then I would write an exam of which I would get my license. So I'm just basically going to talk to you guys today on how it is like to work in Nigeria, what it is like to work in a different country. So right now I'm doing my training in hospital pharmacy. So I am a hospital pharmacist as of now. I work in a prestigious hospital in Nigeria, in Lagos, which is the most commercial city and economic city in Nigeria. So I did do my internship also in India. I worked at the Divine Heart Hospital, multi-speciality hospital at Lucknow, and I did do my internship also at Artemis Hospitals in Gugaon. So I do have an experience in hospital pharmacy before I came back to Nigeria. And the difference there isn't much difference between hospital pharmacy in Nigeria and hospital pharmacy in India. There's just maybe a slight difference in the outpatient department, where in Divine Heart Hospital, for example, we were taking the billing. When patients come to buy their drugs, we would collect the money. But in Nigeria, there's a billing department that does that. And so we were not involved with billing in Nigeria. So also there is in India there's something called a drugs therapeutic committee, where it's made up of doctors and a pharmacist and nursing and a hospital administrator, but we don't really have that in Nigeria. And in India, when I was doing my internship, I don't think we ever had a journal club. But in Nigeria, we do have journal clubs, and we have clinical meetings where interns and professionals can go and discuss on various topics. So a daily life, what it is like to be a hospital pharmacist in Nigeria. Basically, when I get to work by 8 a.m. in the morning, I have to deal with the inpatient and the outpatient, and sometimes I also have interactions with the medical store. So the inpatient pharmacy has to do with dispensing of drugs to patients that are admitted in the hospital. So we have patients who are already admitted and they need drugs. So most of the times when we are doing that, we interact more with the nurses. So the nurses from different wards, we have the medical ward, the surgical ward, the pediatrics ward, the obstetrics and gynecology ward. The nurses from those wards come to the pharmacy with the prescription written from the doctor for each patient. So in Nigeria, we practice what is called the single unit dose medication dispensing system. So that is when we dispense drugs on a daily basis to those that are already admitted. There are other types of dispensing systems, but that's what we use in Nigeria. And so we dispense injections on a daily basis as drugs that are taken IV, suppositories, and parenteral drugs and suppositories are usually given on a daily basis. So, like I said, we give the parenteral drugs and suppositories because suppositories are not under parental drugs. We give them on a daily basis while we give oral drugs that are taken orally, we give them on a 4-day basis. So we have a different arrangement of how drugs are here in Nigeria. You must have been taught about the ABC systems of drug arrangement and drug stocking. We also have, that's what we use here in Nigeria. We have drugs arranged based on how the C system, we have the expensive drugs that occupy about 10% of medicines, and they are kept in a separate place. Usually we have them kept in the chief pharmacist office. And then we have cold medicines. These are medicines that require a temperature of 2 degrees to 8 degrees Celsius. We have them kept in the refrigerator. And then we have the cheaper drugs, that's the class A and B, arranged on the shelves in alphabetical order, having the ones that are going to be expired kept in front, and the ones that are just coming in, the batch of drugs that are just coming in, we have them kept at the back. Then we also have the medical store in the hospital, where the medical store is the place that houses all the drugs. Immediately they come from the suppliers, they go straight to the medical store. So the medical store has the entire bulk of drugs, and they have also disposables that are needed in different units like the theater and the renal unit and the oncology department, and also the pharmacy. So we as pharmacists, we go there every week to get the weekly supply that we will need at the pharmacy, so we don't have to go every day, and so that it's easier to take stock. And if I did not mention this, or if I had, we also, part of our duty is also to take a daily stock so that we don't run out of drugs. So we take the daily stock every day, and any drug that has reached its minimum stock level, we notify the chief pharmacist so that they can start requesting or making requisitions for those drugs, so that we don't run out of drugs in the pharmacy. So that is basically most of what I do for now. Then by the end of this 1 year program, I would be writing my license exam so that I'm able to go for my master's program. And yeah, so I want to thank you all for listening and being a part of this. Thank you for the I hope that you are able to have an idea of what it's like to be a hospital pharmacist in Nigeria. And I also want to say a big thank you to Dr. Rao Shukla for the opportunity to give this talk on the topic and to be able to share what I'm doing right now with future pharmacists. So I'm saying thank you very much, Danya Vad, Shukriya, and God bless you.